Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country.
Welcome to another Native Bidaské. I'm Levi Rickert, and we're coming to you from the White House Tribal Nations Summit here at the U.S. Department of the Interior. And we have two distinguished guests with us today. And to my left is Lummi Chairman Tony Hilary. Tony, say hello to our guest.
Good day.
And we have Nick Lewis, who's a council member at the Lummi tribe, and he has several titles, but one that really relates to this topic here is he is the vice chairman of the National Indian Health Board. So, gentlemen, Chairman, you were just on stage talking about the president's signing of the executive order yesterday and how that's going to help your situation in Lummi. And for some of you who have been tracking this, the Lummi Nation has lost a tremendous amount of drug overdoses. So, Chairman, how does the president's executive order help?
Yeah, thank you, and thanks for having us. So we declared a state of emergency to the fentanyl crisis this year, and have had an overwhelming amount of overdose deaths. Still, we remain ambitious to make change and to better the future for our children and grandchildren. And this summit is a great indicator that change will come, coming together with tribal nations and the federal government to talk about concerns and issues, barriers, and ways that we can find solutions together is really important. Yesterday, the president enacted an executive order regards to self-determination and honoring treaty and trust responsibility. We're still processing everything that was stated yesterday and filtering down what that executive order means, but hopefully it will be a step in the direction of working hand in hand as partners with the tribes and honor treaty and trust responsibilities so that we can take care of ourselves. And we hope that it's a step in the direction for President Biden to declare a national state of emergency to fentanyl. That way we can tear down some of the barriers, the bureaucracies that put a hindrance on our ability to hear ourselves.
Can you put a dollar amount on the need, particularly your tribe, up in Upper Washington, when you're close to the Canadian border? I understand on it. It's only be a good person.
I don't want to put a limit on it, but we could easily come up with an exact amount of what we need in regards to the fentanyl crisis, but it touches so many different areas. The complexities of that issue, it's ongoing and heavy. Given the severity of the issue, we're still learning a lot about what needs to happen to address it, from prevention to intervention, rehabilitation. Even the decline of salmon is an issue in the Pacific Northwest, and that there's a lot needed there to restore and recover our salmon species. So it would be a lot, but I know that Portland Area Indian Health Board and the National Indian Health Board also compile a lot of research on what the needs are across the country as it relates to some of the state and federal legislation that comes forward to address these issues. And so it's a unified front, and we'll work it hard, but it's going to be a lot.
And Nick, you are president of the Portland. No, do you have a good sense of how much more money is needed?
I think even though we have a number, what full funding is for IHX, we know what that is, but as the chairman said, Sarah, this really is so complex and it touches so many things. You look at the trauma that's going to come. It took us generations to get to this other point. It's going to take us generations to get out of this. And as the cost of education and everything keeps going up over time, you know why the whole budget today is not good enough for tomorrow. And that's why I think what we got out of the report and the summit is a lot of recommendations. And some of the recommendations being all budget related. Sarah, what we really there with is the government to be our wage was very carriers. And I know things in forward and it was signed yesterday that any fault was in those names, which the chairman said we do then process and analyze a lot of those who were in the episode. And how we can look into this, so it's man, yeah, this would be great.
Now, you had, what, 4 tragic deaths? Was at the end of September, is that, as I recall? And tell us about some of the social economic conditions of your tribe in terms of, is there a need for more housing? What are some of the needs?
Yeah. Well, gosh, don't get me started. There's a lot that we need to address. Housing or being one of them. Transitional housing, low barrier housing, as well as kind of looking at the full journey to wellness and to the person's pathway to recovery. It starts from birth. So the needs for caring for those, the mothers who are pregnant and those that are living in poverty or struggling with addiction, when it starts there, all the way up to elder care. And so the need is great. Right now, the idea for Lummi Nation is to address jurisdiction issues and to get drugs off of the reservation as part of our responsibility as a government, to give people a fighting chance to seek treatment and have the resources. And so as a part of the jurisdiction issues, getting drugs off the reservation, addressing non-tribal drug deals on the reservation, the need for treatment and detoxing and everything that follows after that, the whole wraparound service is going to be centralized.
So it is very difficult to give a price tag for all of that. Now, as I thought you testified on Wednesday.
News Online, we believe in the power of journalism to strengthen tribal communities. We rely on support from readers like you to fund our daily, in-depth reporting. The funds we raise during our year-end campaign are crucial for 2024, sustaining journalism that matters in Indian country. With the upcoming 2024 election, we will provide important coverage to ensure the Native vote is heard all the way in Washington, D.C. Your funds will be well spent because we are trusted in Indian country. We make an impact by informing and uplifting our people. Our mission is to make sure Native people are seen, heard, understood, and valued. That's why we've written hundreds of stories about Indian boarding schools, the repatriation of our ancestors, missing and murdered Indigenous people, and the overdose epidemic in Indian country. So, during the holidays, please give from your heart to help us reach our year-end, much-needed funding goal. To donate today, please scan this QR code or go to the link below this video.
This drug epidemic in Indian country. Matt, I'll ask you this. Who should take responsibility?
I think the pharmaceutical companies need to be in all the responsibility. I will see whether in the news the discussions that are taking place, whether certain people are immune from prosecution. We need to look there, but I think it's the whole system that we created there, Freehand. And one thing I will say is, I think the system is again really held accountable and looking at that is what we see is people get stuck in silos, and we struggle to remove some of the barriers that the system has created over time. And the system have created over time for different reasons. And one thing that I think we struggle with is understanding that any system, any policies that document the vision, that we need to make sure they can evolve what's fine and goes what we see was open off. This isn't like anything we're seeing before. This is playing out keyboard. Highest rates and it's everything beside different issue.
Really sad. He was saying that you were on our live stream a month or so ago. We talked about how our ancestors did not survive genocide or any borders was swearing be you can do this shipping. If it's well, that can.
I've heard this from some of our tribal leaders in our area. We're seeing our death rate is decreased in 7 years over about 8 years. There's published in the CDC.
In the life expectancy.
Yes.
This is great.
So COVID had a part with that, but we didn't even do it. So I didn't make it to Illinois death rates. So ethanol is having a big part in it.
Wow.
And as our chairman has shared in other states, like, we're seeing people younger and younger dying. When we see children and people that are supposed to take our place, we're losing their lineage. You just fitting that, and it's like the trying to stop our and what we are, as our chairman says a lot, is we have the opportunity. We also have the opportunity to do something about it today. That is just good. And
Now, in terms of the stigma associated with drug usage, and someone gets arrested for drug use, the old hard line, throw away the key. At this conference, at this White House summit, I've heard a couple people say from stage that we really need to have a little bit of passion. Deal with them not as criminals, but to rehabilitate things that are incarcerated. Right. What's your view on that?
Yeah, absolutely. That's probably one of our biggest challenges as people trying to address this issue while we have so much difference in respective opinion out to do it. And the biggest difference between having tough love, throw away the being correct, but also harm reduction or having come out and people hurting then. And so our approach is that it needs to be everything, but we can't be on one way versus the other. It can't be one political issue versus the other. It has to be a holistic approach where working together to practice tough love at the same time as showing compassion and the empathy that a local matter are struggling with. So,
and Nick, what do you have to add?
I think if you look at the chats and you look at the responses across the country, you see, and then find this where we know this news that's happening. We know that really. We see the government take the stance, they have blocked for the day being in cases, and it's doing is cause it from it in a community for God's sake. Yeah, and they sometimes use and they're on. And then so the chairman's talking and really about finding that value. We have to have community safety that advocates against armor best. We need to have armor best, so you bring up to the stance and the thing to them. And trying to find that balance. And that's one of the things you're really tired to talk about the summit. And it's just out to pushing this where I think what we're showing, we have been underfunded and posting our data shows what it shows you, because we also still do have a resilience in our ancestors to pass that. Come on, really understand our other ENC is what little we have to take care of our community. Trying to focus should up and we back some interview shown and spoil this for linked areas. Because COVID known about, they didn't know the reservation and now it's out of our lot. And when we take a trinity approach, we're doing the best that people do not, that we need, as it was our COVID response, our Vietnam response, we're trying to push that same kind of concept to me. And it really is about balance. And that's one thing we're excited to live in at this conversation is even though you're still having that, the thoughts on that, the thing inside the city out and bring it together. We're so nice.
Listen, French Chairman, well, Mick brought up COVID-19 or pandemic, which is tragic. Did you need more people to this drug overdose treatment than would you have to COVID?
Yep. Yes.
Well, yeah, that's pretty significant. And there was to lay out there right to the or in the 48. She was coverage, still 80 son. Yes, and it was over coffee beefy. There's a bit of happening.
We are hoping to United States, but at the same, the Caribbean non-electing still. Any coming? Now, but the other name, it's been incident about enemies, the other team, they send the check.
And Chairman, you were on our Native Bidaské, I believe, this past April, and I can remember there was a moment and kind of emotion for both of us there. But this issue's not going away anytime soon, is it?
No, but we have to ensure hope. And one thing that is making us hopeful about what
Councilman Lewis was talking about, either a national or opioid summit report has been released. So it is a working draft and a document that will continue to lead us and guide us through some of the policy and being administrative and legislative already in the role on the federal level.
And so reviews on just report this week, as I understand.
Yeah, exactly. So we really want to encourage tribes to get involved and share their story, share their voice, and what they see as solutions to this issue, because it will be ongoing. One of the real concerns is the progression about fentanyl, how strong the opioids have gotten over the years, and what's coming next. And so while we focus on this issue now, we also are forward thinking into the future. So it will take time, but the more we talk about it, the more we come together as tribes and as the federal government, the podcast, the better.
Well, gentlemen, you both are doing tremendous work. I mean, it's hard work. It's hard work. But thank you so much, and thank you for coming on Native Bidaské. And to our viewers, thank you for tuning in to another episode of Native Bidaské. We'll be back next week with a very important issue again. More covers on the White House Tribal Nation Summit. Keep it good. Have a safe week.
Thank you.
If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Chimi Gwech.